Hey guys, thanks for joining me again for another episode on my YouTube channel, Long Live the Brains. Today I'm going to give you a bite-sized piece of information about dementia with Lewy bodies, or DLB. In video 41, I talked to you about how Parkinson's disease is a proteinopathy, in that it's due to abnormal accumulation of a protein called alpha-synuclein, and those abnormal accumulations are called Lewy bodies. And that's where we get the name for Lewy Body Dementia. Both Lewy Body Dementia and Parkinson's disease share a similar pathological element, that being synuclein, or the Lewy bodies. So, dementia with Lewy bodies, as the name would say, is characterized by dementia. Now, this early on in the disease can be confused with Alzheimer's, and in fact, many patients are misdiagnosed with Alzheimer's disease. And an important point is that dementia with Lewy bodies is in fact the second most common cause of dementia, right behind Alzheimer's disease. So, cognitive dysfunction, dementia, early finding in DLB. Now, as the disease progresses, it tends to become a bit more clear because the type of cognitive dysfunction is a little bit different than Alzheimer's disease. But these patients may also experience visual hallucinations. These are formed visual hallucinations. So not like the distortions that you might have with a migraine aura, like squiggly lines, or some people describe those auras as like they're looking through fog. But what I'm talking about is really seeing actual formed images. So you might see people, or you might see shadows. So it's a very different type of visual phenomenon. These patients may also experience mood disorders such as apathy, anxiety, depression, and even delusions. And also Parkinsonism. So I've talked in a few videos about what Parkinsonism is, that being resting tremor, rigidity, bradykinesia. And so from this hodgepodge of symptoms, and trust me, there are many other symptoms that can go along with this disease, it's easy to see how it might commonly be misdiagnosed as other things like Alzheimer's disease, Parkinson's disease, just flat out depression, or even schizophrenia, and many others. So that underscores the importance of a thorough evaluation by a neurologist to make sure that an accurate diagnosis is made.